I'd like to take a minute to welcome everybody to the first ever Forum for the Cure for Parkinson's. First of all, I wanted to thank you all for coming. We had no idea what to expect this year, and it is very good to see all these seats full. We are in a time of remarkable hope. There's a lot of things that have happened in the past couple of years, and I think that it's important to start our day off with that feeling of hope that we have at the foundation. So I'm going to welcome Darryn up to the stage. Tell us a little bit about yourself and your role with the foundation.
Yeah, so my name is Darryn Pulanco. I am a senior Philanthropy Relationship Manager at the foundation. I've been here for a little bit over 3 years now, but really in my role, I serve as the main point of contact for lots of our community members in the states of Pennsylvania, New Jersey, and Delaware. So I'll be traveling, going out, meeting with folks one-on-one, answering any questions that people have, and also giving updates at different support groups also.
What we do at the foundation is, I think, so different when it comes to research than other Parkinson's organizations. So I want to talk a little bit about how we started and why research is so important to the foundation.
Of course, as I'm sure many of you here in this room know, the foundation was founded in 2000 by actor and person with Parkinson's, Michael J. Fox. And that was really, I think when he was diagnosed, he was looking at the landscape and realized that there wasn't really a ton of work, or at least as much work that should have been done in the Parkinson's disease research field. So he then created the foundation with the goal to fund research, to try to find better treatments, and ultimately a cure for Parkinson's disease. And I think since being founded in 2000, I think the number is we've raised $2.5 billion for Parkinson's disease research. So that's billion with a B. So that's something that we are very proud of as an organization.
That is worth a clap. That is worth a clap.
When I think about a couple of unique things about our organization, I think about kind of our efficiency as well as how we decide to fund research. So just by the numbers, as an organization, it is 88 cents of every dollar raised goes straight to Parkinson's research. On top of that, 100% of anything raised through Team Fox goes directly to research. So all those community fundraising activities, you can be ensured that all that will go to Parkinson's research. We also do not have an endowment as an organization. So what that means is that every year we raise money, and then by the end of that year, we get really close to spending all of those dollars, and then the beginning of the next year, we kind of start over again. And then we get funds to the researchers' hands within 3 to 6 weeks of receiving it. So we really don't hold on to it either. Once we get it, we do the best we can to get it into the hands of our researchers. I think the other unique aspect of us as an organization is how we decide to fund the research too. So we actually have an internal team of PhDs and neuroscientists that are always taking a look at the field and determining what is the trials and projects out there that are going to have the most positive and the largest impact on the community. On average, we review about 1,500 grants and end up approving about 600 of those. And then out of that 600, about 40% of those are international. So we really don't care where the idea is coming from, as long as it's going to have a positive impact.
And I think too, what's so important about research and funding it is I think we have seen, during COVID, like the science, people are ready to do the science, they just need the funding. COVID happened, and once we put the money where it needed to go, like we had a vaccine pretty quickly. So I think that's what's so important to us, is to get that money where it needs to go as quickly as possible. And right now, especially, I think Debbie Brooks, who's our CEO, told me, I think it was in September or October, is that right now, though, the science is outpacing our dollars, and so it's more like days that once I cash that check at the foundation, that money is in the scientists' hands. So it's just unheard of to get those things turned around as quickly. Another thing that I think is so unique about the foundation is our science. We have it, it's almost like open source. So anybody can download it, anybody can use it. We don't want to do the research and then hide it from the world. We want anybody to be able to do it. So say I've done this research, because I'm clearly a scientist, then you could take it and download it, and maybe whatever I did is the next step you take finds a cure. Like, we don't want to stopgap that and keep it from happening. So it's very unique. Also, just looking, when you look at the scope of all the drugs and all the things, one of the main drugs for Parkinson's that a lot of you probably take was made in what, the 50s, 60s?
Yeah, yeah.
And you're all still probably, it's carbidopa levodopa, right?
Yep.
In the
Gold
60s.
standard. Yeah.
Like, why do we not have a better drug? That's why we need to put our money where the science is. My dad always said, you can put me up on as much carbidopa levodopa as you want, as long as you can cure the side effects of that. And so, we have things that can help with the tremors, with the, dyskinesia. We're trying to help with all those things along the way, and we found all of these things. But that main drug, that gold standard, is older than me. So, we're working on it. We're trying, for sure. So the other thing, and I don't know how much everybody here knows about it, is we had some pretty big news. What year is it? Last year?
Yeah.
Last year. We have a really important trial. So obviously part of research is trials. We as a foundation have been pushing trials for a long time. You'll see on your table there are some little orange brains that came from Florida. My mom sent them up. If you are not involved in trials and would like to be, Fox Trial Finder is a great way. You can also talk to your doctors, see if there's anything around here or online. I've been on an online trial for years. You don't have to have Parkinson's. We're also always looking for controls. Being involved in trials is really, really important. That's how we get these drugs to market. But PPMI, let's talk a little bit about PPMI, which is one of our landmark trials. Actually, my mom did PPMI for a long time, years ago. Let's talk a little bit about PPMI, and then we'll talk about what happened with it.
So PPMI is actually short for the Parkinson's Progression Markers Initiative. And Kate, like you mentioned, that is a landmark study that the foundation runs that was started in 2010. And in that study, we collect data and samples from people who have Parkinson's, people who might be at risk, as well as healthy controls. And really, with that, we want to get a better understanding of the basic biology of Parkinson's, as well as its progression over time. So actually, since being started in 2010, it has now become the largest data set of Parkinson's disease information available in the world, also available for free, and has been downloaded over 16 million times. And what that has actually helped with in the field is that it has made clinical trials a lot faster and also a lot cheaper. Because now we have data and samples already available for researchers to go access. And so once they have an idea or a hypothesis they want to test out, they don't have to worry as much about getting samples or getting participants for their study. They can reach out to us and get that pretty quickly and pretty easily as well.
And the goal here for PPMI was to do what?
So I think really to just get that better understanding of that basic biology and progression. And then we actually saw that it was so successful and so important for the field that in 2020, we launched an expansion of the program. And so we actually grew to over 50 international clinical sites. And I think we're at something like over 4,000 in-person participants or something. So if you are interested in participating, there are also different ways to participate as well. There's kind of more in-person in clinic where you're going more regularly. There's a version of it where it's sometimes in clinic, more so online. But there are centers at Johns Hopkins as well as UPenn. So there are a couple of different options around here. And if you are interested, you can always go check out michaeljfox.org/ppmi for more information.
So in 2023, I can't remember who was with me. Emily, were you there? No. Matthew and I were in New York for MVP for Team Fox, which is a gathering that they do once a year. So people who fundraise a certain amount gather together and are celebrated by the foundation. And we were sitting in the room, and there was a huge announcement, and it was wild, just to be in a room full of people who have fundraised for a cure for so long. And the announcement was that PPMI had finally done it. We had found a biomarker. Now, not as exciting as a cure, but also very, very exciting. So what is a biomarker and why should everybody in this room be so excited?
Yeah, so a biomarker, just to take a step back, is anything that can objectively measure the presence or progress of a disease. So as a couple of examples, you could think about like blood sugar for diabetes or cholesterol for heart disease. And we didn't really have that for Parkinson's before. But like I mentioned earlier, we had a scientist on our team. Her name is Dr. Samantha Hutton, and she actually saw that there was this test called a seeding assay test that was being developed for a different neurological disease. And she thought that it could have some really great application for Parkinson's. So what we did is we actually reached out to that research group out of the University of Texas, and we asked them if they would be willing to work on it. And they said yes, but they would need two things. They would need funding, and they would need samples. So we were also luckily able to give them the funding, and we had the samples already available through PPMI. So that's the PPMI part of it. And so this new biomarker test is called the alpha-synuclein seeding accumulation assay. I'm sorry, it is a mouthful. It is a hard thing to say.
The number of acronyms and things from the foundation is wild. Like they give you a guide when you start working there.
Yeah.
Also, spelling alpha-synuclein, good luck. You'll never get there.
Yeah. But the way that this test works is we actually take a sample of spinal fluid from a person and we inject it with synthetic alpha-synuclein. And just take a step back, alpha-synuclein is the protein clumping in most of the brains of people with Parkinson's that we see. And so once we inject that synthetic alpha-synuclein, we shake that test tube up for like 24 to 48 hours. And then after that amount of time, we go into that sample and we see if there's clumping happening or not, any clumping happening. If there is clumping, we can confidently diagnose and see the presence of Parkinson's in that sample. And if there isn't clumping, at that point you might want to consider different testing methods or possibly a different diagnosis.
So in finding the biomarker, what does that mean? And it's a biomarker, it's not the biomarker. What does that mean for patients?
Yeah, so I think right now, in the most immediate term, the biggest impact it's going to have is going to be in research. I think, and our scientists have been saying this in the past too, Parkinson's disease trials have been very tricky. And that's because up to this point, we never really had a tool that could see inside the body if, that potential treatment or drug that person was taking was actually stopping, slowing, or reversing the progression of the disease. All these scientists had to go off of were just outward symptoms and observing that. And as I'm sure many of you here know, that can change from day to day, right? That could be if you didn't get enough sleep the night before, if you didn't eat breakfast, or if the drive to the clinic was particularly stressful. All those things could affect your symptoms, right? But may not be a true reflection of if that therapy you're testing out is actually working in the body, right? But now we have that tool. So now scientists can objectively see inside the body if something is stopping, slowing, reversing the progression of the disease. So with that, clinical trials are going to be a lot cheaper and faster. So from your end, you should see a lot more therapies coming through the pipeline a lot more quickly and a lot cheaper than they would have before.
And also with that, we found that it can be found in patients up to several decades before they even are diagnosed with Parkinson's disease. So we can start to study people before they actually are diagnosed and have symptoms of the disease, which can be a game changer as well.
Yeah, that was, I think, one of the most interesting parts of when we found this biomarker, and we were using samples from PPMI that we qualified as at risk, because when we got these samples from people who weren't diagnosed with Parkinson's, but they were showing up positive on this seeding assay test, and we thought that was kind of strange. But I think it was like 5 to 7 years or something from that point when we collected that sample, these people actually went on to develop Parkinson's. So that goes to show that the clumping of alpha-synuclein that's happening in the brain is progressive over time, and it's actually happening before any diagnosis or possibly any symptoms come to the surface. And so that's a really exciting development once you start to think of future preventative trials for Parkinson's also.
Which makes sense too, if you think about, I mean, how many of you with Parkinson's lost your smell probably years before a doctor told you you had Parkinson's? Yeah, a lot of you. I know my dad definitely did. Or, you know, you started going to the doctor and it took how many years for them to say, oh, you have Parkinson's, because you were going for one symptom, and then it took, you know, oh, wait, all of these symptoms together were Parkinson's. And the cool thing about the biomarker is, since, you know, this has happened, you know, when we were talking about the biomarker in New York, they then brought out a couple of researchers who have used that data set to now to do different things with it and develop practices and devices and other medications that are now on the market that aren't necessarily cures, but things that help with the disease. We met someone who, I think it's an implant for swallowing.
Oh yeah, the Atom
Yeah,
device.
because I'm sure many of you may have noticed you have some issues with swallowing. People with Parkinson's swallow on average, I think it's like,
A lot less.
yeah, a lot less. So this device trains your body to swallow, which then helps with drooling and other, you know, issues with that. There was also, I can't remember what one of the other ones was, but you know, things are coming out of this that isn't just, you know, biomarker related things, because they're able to download the data set and do other things with it. Are there anything else of note that's like in the pipeline right now that's exciting?
I think the most recent one that's actually out of the pipeline, it was actually approved maybe a couple weeks ago. It's called Vyalev, and that's the new reformulation of levodopa-carbidopa, and that is a subcutaneous thing, like 24-hour stream of your levodopa-carbidopa, and that's really meant to increase the amount of on time that you have, and so you don't have to go through the off time when, you know, you're kind of waiting for your next dose of medication, but you can start to feel the symptoms come up again. There is also the Atom device that you mentioned, and that's that kind of sensor that you put on your throat. It was actually developed by a dermatologist, which is a really cool story. But it goes on your throat, it vibrates at certain times to help kind of train your body to help swallow and strengthen your throat muscles as well. That's also in phase 3, so that's kind of in the last stage of clinical testing before it goes on to be approved. And I think one other one that is really exciting is there's actually another device that is also a subcutaneous pump of levodopa-carbidopa, and that actually finished testing also. So right now they're just waiting to hear back to get some feedback from the FDA on how they have to get approval, but we're hopeful we can hear back, if not by the end of this year, hopefully early next year.
I have to say, I'm excited about new ways to get carbidopa-levodopa for off periods, because my dad had the pump once his medication stopped working, and that pump is God knows how old, like the technology, and it's a PEG-J tube that they have to surgically put in, which, because you move around a lot, sometimes you can tug out. So we had, I mean, in the first year that he had it, we had 3 surgeries to put it back in. And the cassettes have to stay cold, and you have to change them out every 16 hours, and so like, to have a new system, again, why do we have these things that are so old about Parkinson's disease? So I know we were in a meeting the other day where one of our head doctors is excited to get more information about the subcutaneous delivery system. So stay tuned for, I think she's going to do a webinar or a post on, or blog post on that in the next couple of weeks.
Yeah.
On what that'll look like for us moving forward. So that's exciting. As we're talking, make sure if you have any questions, you can write them down. And Emily and Matthew and some other people can, he just got up, so I said his name and he's panicked, can pick those up for you guys. But that's, again, another plug for trials. That's why trials are so important, because if we don't have people participating in trials, there are not enough people to help get these to the final stage and onto the market. And we do need controls, and we also need people with connections. So people whose parents have Parkinson's, you know, people who are at risk. stuff like that. There are also really easy ones. I understand if you don't want to go get a lumbar puncture, which mom did for a while, so it's not that scary. There are things like a smell test, which I believe we have. We have cards for back at the table, where we send you a little kit and you scratch and sniff it at home. So things as easy as that. The one I do is every 6 months they send me something online to fill out. It takes a few minutes. So they're really easy ways to participate and help us move forward for a cure. What else should we talk about? What other things are exciting?
Oh, Vyalev. It's I think I'll spell it. Vyalev.
Very nicely done.
Thank you. That was just approved a couple weeks ago. So that one is very, very new.
Yeah. The other exciting thing, so we talk about the alpha-synucleins and the clumping of that protein that we know causes Parkinson's in the brain. A lot of diseases, and my dad said this forever, and so I've adopted it, so I hope it's true. Correct me if I'm wrong. I think that I do believe that when we cure Parkinson's, that it is going to do so much for other diseases like dementia and Alzheimer's and Lewy body, because all of these other things involve clumping of proteins, just different proteins in the brain. So if we can figure out why that protein is clumping, then it probably will help towards advancement of why other things are clumping. So like give us, put the money into it. We got the money, let's go.
Yeah, that's actually been something that I think definitely more recently we've been really focused on and working on also. And Kate, like you mentioned, we see that in a bunch of different neurodegenerative diseases. There is a clumping of some type of protein, and it's just different proteins in different diseases. But we also see that a lot of the risk factors are the same between all these diseases. So you're thinking things like exposure to certain things in the environment, so like pesticides, for example. Trauma to the brain, so people who might, experience concussions or things like that might be more susceptible also. And so we are constantly working with different organizations across different fields to help fund research and also educate people as well.
There was something recently, I feel like I read about the gut and linking Parkinson's to the gut.
Yeah.
I don't remember. Do you remember what that was?
So there's we're always trying to figure out like what is causing the alpha-synuclein to clump in the brain, and there's our scientists are still working on it, and there's lots of different theories out there. But one of the very popular ones is the connection between the gut and the brain, and we know that people's digestive system is very very connected to their brain, and we often also see people who can make adjustments in their diet that really affects their symptoms and helps to improve their symptoms also. So that is like another connection that we're definitely putting funding and research into.
So we should eat more candy on the table? Sorry.
Every once in a while, it's okay, probably. I'm not a scientist, though. I probably can't say that.
Everything in moderation. Yeah, I can grab it. Oh, I think we get this question a lot. It's a great question, and then we can talk about that. I feel like we get this question a lot, so I'm just going to ask it before anybody else needs to ask it. How long till we have a cure? How many years do you think, Darryn?
Yeah, we do get that question a lot. It's really tough to put an exact number on it. I think the comparison that our scientists have shared is that if you look at the cancer field, approximately about 20 years ago, it was so much different than the way that it looks now. And like now we're in a place where we're able to subtype different types of cancer and then also treat and cure those based on that type of cancer. And that I think that that's the spot that we are aiming to be in the Parkinson's field in the next, whatever 5, 10, 20 years or so. What I will say is that we already have lots of therapies in the pipeline that are looking at ways to either prevent or break down the clumping of alpha-synuclein in the brain. So I think right now we have, I want to say I think the number is 15 or so trials that are specifically looking at alpha-synuclein. But as a field, there are like 150 unique therapies that we have in the pipeline, just looking at different approaches and different techniques to help prevent and cure. But I think, yeah, I can't put an exact number on it, but I know our scientists are hopeful that within the next, I don't know, like 5 to 10 years, we're going to come out with something. And like it may not necessarily be what is considered a cure, but definitely a major step up from what is at least available right now.
This is a great question, and then we'll talk about more about this after the question. But did the biomarker help with the success of the National Plan to End Parkinson's Act?
Oh,
And then we'll talk about that. I guess we could just talk about the act
yeah.
first, and then
Great segue.
yeah.
Thanks,
Lori.
I would have to imagine it did. And I think the biomarker is something that we've been trying to find for years, and also we are still looking at developing different tools that could also be a biomarker as well. The one that I mentioned before involves a sample of spinal fluid. There's also like imaging tracers that we're trying to develop, and we've actually been working on that a little bit longer than this one for a biomarker. But yes, exciting news. National plan is passed, and that was this summer it was passed. But that was really, I think, that was born out of the big health disparity and financial disparity that we saw in this country, of what at least it costs to care for Parkinson's, and then how much was given from the federal side in terms of research. So it was, I think the numbers that we found were, on average every year, it's $52 billion to care for Parkinson's, but federal research has stayed flat at $250 million for the past handful of years. So that's a humongous gap that you're seeing there. And so, this plan really has intended to increase the funding that the federal government is giving to research. And so when it passed in this summer, it is now going on to the Department of Health and Human Services. And now their next step is managing and creating this thing called the National Parkinson's Project. And they're going to be putting together almost this federal advisory committee that'll consist of different federal agencies, researchers, Parkinson's organizations, as well as I think scientists and people living with Parkinson's, really to kind of determine what the direction of Parkinson's research should look like in the future, and also hope to increase funding as well.
Awesome. Yeah. We have someone who has been a participant in the INSIGHT study for several years. Me too. How is that info being used?
Yeah, so I think I think it's very similar to PPMI, but I think Fox Insight is a little bit different. And I guess, Kate, you can tell me if I'm wrong because you're a participant, but it doesn't require you to go in clinic as much. But I think it was very helpful for us to get information that maybe is a little bit more maybe unconventional, at least from the eyes of scientists. I think we really use it as a very helpful tool, especially during COVID, when it was hard to go in clinic and there were different things that were affecting people. Even the sense of losing your sense of smell. I think that came up during Fox Insight. I think what we're trying to work on now, in particular with Fox Insight, is identifying people who are in that study that can also participate in PPMI in different ways. And as I mentioned before, with the expansion of PPMI, I think we're also broadening the range of who can be a participant in PPMI. So I think before, what we were saying was we were looking for people who were newly diagnosed, and we kind of defined that as, I think, 0 to 2 years within diagnosis. And I think we're actually increasing that now, I think, up to 7 or 9 years within diagnosis. So I think there's going to be some people who may not have been eligible to participate in PPMI in the past, and therefore went to Fox Insight. But I think we're going to be able to bring some people from Fox Insight into PPMI.
That's how I got involved, because I wanted to be in PPMI, but I don't qualify. So I was like, fine, I guess I'll do it inside. It's also interesting because every time you go in, it asks you like, is your handwriting smaller than it was? Are you having trouble walking? Have you fallen? You know, those kinds of things. So it could kind of, it helps you kind of track, you know, if things are changing in your life. It also makes me laugh because every now and again, and during COVID, you know, you would take it, it would ask like, do you think that it's a great time to be alive? And I'm like, it's COVID. Like, this is going to skew everything. Like, does acid reflux show any correlation to Parkinson's?
Huh.
I don't know if we've proven that, but I would
Yeah.
imagine, I know a lot of people with acid reflux who also later have Parkinson's. And if you look at the gut and the esophagus and the swallowing issues and all of those kinds of things, I wouldn't be surprised if it is all tied together.
Yeah, I haven't heard that before, but I agree with like what you're saying. If you're looking at the gut brain connection, you're looking at issues with swallowing that people with Parkinson's often deal with. That kind of makes sense. But we can definitely ask our
We
team, and
also
they're gonna
have,
know.
we have a doctor here, so maybe they know.
I'm not a scientist, so I may not be the best person to speak on this. But with your Parkinson's medication, there are essentially different ways that can work. You know, like you can have medications that can help kind of transport the dopamine in your brain to the right place, and then you have other medications that kind of help to artificially increase or kind of give you the dopamine in your brain that it needs. So there are different kind of mechanisms for how different Parkinson's medications work. But the GABA is a certain mechanism, and I'm not sure which one that is, unfortunately. But yeah, we can follow up with our research team about that one too.
If we don't answer your question, come get our information
Yeah.
at the table and we'll connect with you. Have we done any work with research that involves studies and pure nicotine, like natural treatments and stuff like that?
I think there was some study that connected the use of nicotine to decreased risk of Parkinson's, which we're not really sure how that works. It's kind of worth investigating some more. But yeah, that one was definitely interesting to see. But I think we are funding research towards that specifically too.
That doesn't mean go out and start smoking.
Don't.
Wait.
Yeah, don't do that, please.
When we were talking about markers and clumping, do we think that these tests will also show Lewy body clumping?
So, so the Lewy bodies are the official name for when the alpha-synuclein clumps. So whenever you see the alpha-synuclein clumping, whatever that looks like is then called a Lewy body. So those are actually the same thing.
Okay. Fertilizers seem to be a starting point for Parkinson's. Would it make sense to focus on the farming community? Do we have any things that do that?
Yeah. So I think that has been a huge focus of ours. And actually before I was covering the states of Pennsylvania, Jersey, and Delaware, I was actually covering the Midwest. And out there, you do see a lot more farmland. And unfortunately, you hear a lot of stories about these people who grow up, you know, on farmland, and they're just like chasing planes that are dropping pesticides and like, you know, don't really know any better. And then later on, you have multiple members of the family, you have siblings, whatever it might be, that grow up to develop Parkinson's disease. And so I know we also, on top of other, you know, pesticides that are out there, there are other things in the environment that we see are connected to Parkinson's. So like Agent Orange, for any veterans, also has shown increased risk for Parkinson's too. And I think that has been a large part of the national plan. Passing is bringing national awareness on the federal level to show that there are things like paraquat, which is a very common pesticide that's used on farmland, and show that that does increase risk for Parkinson's, and banning that so that we can reduce risk.
My dad used to say they used to ride their bikes after the pesticide trucks, and he's like, I wonder if that did it.
Yeah. Probably didn't help.
Yeah, neither did all those concussions, but you know. When we say open source for the data, does that mean anyone can access it or just qualified scientists? Like, could I go online and download it?
Yeah. Qualified scientists. So you don't have to worry about, like anybody online getting a hold of your information. But there's a whole entire process where you have to request and like fill out a form, talk to somebody on our team, and then also depending on, what it is that you're looking for, there will be different steps to get a hold of that. If you're just looking for data and for numbers, you still have to go through a process for that, but that'll probably be quicker than, let's say, you are trying to get a hold of like samples, like actual biological samples through PPMI. That'll take just a little bit longer, just because those are also a little bit more limited. But yeah, open access does not mean open for everybody, fortunately, just qualified scientific community.
Is my personal data included on that?
Yeah, your personal information should be all de-identified. So like nobody should be able to be able to tie that specifically to you as an individual.
Good. Can we talk a little bit about stem cell research?
Yeah. So stem cells have always been something that the scientific community has had a lot of potential. And also to clarify too, where the field is at now, a lot of our work is looking more so at mesenchymal stem cells and not embryonic stem cells. So mesenchymal stem cells are stem cells that are created, that are kind of reverted back into stem cells, but we use adult cells to create those. And the thought with stem cells that we're thinking could have a lot of potential for the field is, let's say we are able to stop or get rid of the clumping of alpha-synuclein in the brain that is damaging the dopamine cells. How do we then rehabilitate those dopamine cells? And we're not quite exactly sure yet. There is the possibility that once we get rid of that clumping, the dopamine cells will get healthier by themselves. But if that doesn't happen, there is the thought that these stem cells can be put into the brain, turned into dopamine cells, and effectively replace the ones that are damaged and no longer functioning. But that is not confirmed yet. That's just kind of a theory that scientists have, and the mesenchymal stem cells are definitely a very high potential idea that we have in the field.
And have there been any studies on more holistic approaches to management, like essential oils, supplements, diets?
Yeah, there have been. I think, and when I'm out talking with different people in the community, that's also something that lots of people do. I think it is very popular. From a scientific perspective, and even when you talk about something like diet, it is a little bit harder to study those things, because you have to be like very specific about like, what are you eating? Exactly what are you eating? When are you eating it? How much of it? And it's very hard to self-report all of those things. But I know us as an organization, we definitely embrace like all those different holistic approaches that people take. And honestly, as long as it helps you as an individual and it's not hurting you or damaging you, and your primary care doctor or your neurologist kind of signs off on it, we kind of say, go on ahead and do it. And it is a little bit tricky too, because everybody's Parkinson's is a little different. So what might work for one person may not work for another. And I think we see that, like, there's people who say that acupuncture is really helpful, and then for other people it just doesn't work at all. So that's not to say that acupuncture, like as a whole, isn't a helpful tool. More so, for some it might, for some it might not be.
Along those same lines, what about marijuana? I feel like we get that question a lot.
Yeah, we do get the question a lot about medical marijuana. I think it falls in the same bucket. You definitely have to talk to your neurologist or your movement disorder specialist to see if that's something that they would recommend for you. But we also have, I think, a whole entire blog post and a guide on our website that, if you are interested, can kind of help navigate that conversation, because also, depending on, where you are, or, your familiarity with it, that might be a tougher conversation to navigate.
Do we have any research based on gender? Basically how women are given smaller dosages than men?
We are constantly talking to people living with Parkinson's. that can kind of bring these issues or bring different things to us. And I think how gender and sex plays a role in Parkinson's is something that has come up and that we're also looking at. I think in general, we do see more men diagnosed than women. But again, that is just being diagnosed. That isn't necessarily that more men have it than women. Um, but I do know that we have put a lot of focus into that, and we do also have lots of blog posts and webinars that are featured on our website that are specifically looking at that too.
I think too, there's, you know, when my dad was diagnosed, I remember being like, you know, you think about Parkinson's, and when we started doing Shaken Not Stirred, our fundraiser that's tomorrow, one of the things that we do with our cocktails is we talk about different people that we've met along the way, because I want people to understand it's not just like an older male disease. I think a lot of people just assume that about Parkinson's. Yes, we might see more men diagnosed, but there clearly are plenty of women who have it. You know, we see a lot of our studies probably trend whiter because white people tend to do trials more. But so then there are cognizant efforts to get more people of color, to go into populations where there are people who are normally underdiagnosed, who maybe don't go to the doctor as much, because it's not like those people don't have Parkinson's, they just aren't going to their doctors and getting diagnosed. So I think that's why it's important, you know, as we reach out. I know we have a coworker who, when I first met her, she said that since she started working at the foundation, I think her mother was diagnosed, and she lives, I don't remember where her mom was, but like they just don't go to the doctor, so she wasn't diagnosed, and like nobody in their community goes to the doctor or is diagnosed, and so like historically, what's that data look like? And we just don't have it. So that's why trials are so important, and why we're trying to get into those populations in general.
Yeah, that was actually a really big part of PPMI, to get that better understanding of what Parkinson's looks like, not only at the basic biology level, but also what it looks like for everybody across the world who has Parkinson's, right? And we have found that there are like certain areas, which is why it's important to have international sites as well, that where there is increased risk for Parkinson's. So specifically Ashkenazi Jewish descent, there is increased risk for Parkinson's that has been found. And then also the African Berber tribe also, where there is a higher risk for Parkinson's. And so that's really important, because as is like, you know, a scientific community, finding those different things that might make one population at risk can actually help the field as a whole kind of understand how is this happening and how is, you know, Parkinson's disease developing in the brain. But Kate, like you mentioned, we are also making lots of efforts to really get all demographics and all people involved in clinical trials, because Parkinson's affects everybody, not just like one or two specific populations.
And the more people, the better, because I think we say it a lot, but you know, you meet one person with Parkinson's, you meet one person with Parkinson's. Your symptoms are different, your lives are different, how you manage the disease, how you live your lives are all different. We have a card right here in the front. Any other questions? We have a few more minutes. I was just thinking about something. I was going to say West Virginia has a large population of people with Parkinson's, and it's not because there's a lot of Parkinson's in West Virginia. It's because the support group there is really motivated and puts a lot of effort into a registry. But it's really funny. So if you look at the data, you're like, oh my God, what's happening in West Virginia? And it's just George and his group is really motivated. So that's why it's important to make sure that you're like looking at all of the outliers. Ooh, sleep issues. Who here has sleep issues? Who had them before they had Parkinson? Before it was diagnosed? Yeah. Have we done any studies on that?
Yeah, so that's definitely a big part of PPMI and Fox Insight as well. But we definitely do see, you know, issues with sleep being a risk factor. So whether that's just poor sleep, or in particular, there's REM sleep behavior disorder. So that's when you kind of act out your dreams. And I know we actually had a webinar with, was it Mike Babiglia,
Yeah.
the comedian? Yeah, he had or has REM sleep behavior disorder, but through a lot of the content on our website, kind of realized that that puts him at risk for Parkinson's disease. But yeah, there is definitely a confirmed connection between poor sleep and REM sleep behavior disorder and Parkinson's.
Is it being studied?
Yeah, yeah. And that's a big part of PPMI and Fox Insight, in particular, trying to figure out what are those risk factors for Parkinson's disease, and then also kind of the time frame for what that looks like, and what can be done in between then to stop or slow progression.
Are there any other questions out there? No. Well, we'll be here if you have any questions you don't want to ask out loud in front of everyone. Thank you, Darryn.
Thank you, Kate.